branch stand is more important than the side branch, so I do not want to distort the main branch stand struct. So if I want to do kissing, then I like to do, preferably I like to do a ABI.
Sir, I like to comment on this. If the larger balloon is deemed to use to open up the start and as well as ostium of the insects, at that time kissing balloon is mandatory. But if it's only small balloon is used, report is enough to reshape the main branch of stenting.
So what is the size of the post dilatation balloon here?
4.5 into
12.
10.
Yeah.
It is in the carina. A bit forward.
No, it's a bit away from carina.
Yes.
But the left main is
Now it is in the carina.
length is good.
Yes.
That's why 10
Go up.
I think a bit more distally.
That's right, but
Sir, it's put little more so that the ostium of the
Yes.
Yes, that's the, I think, no, sorry.
all right.
Stent goes, sir.
Yes. Are you happy now?
Yeah, this is perfect size.
Okay, go up.
This is
Better.
Go up. Slip.
Down, it slips, sir.
Yes. Reflect. Side branch, wires. In the side branch I have wires, so I shall have to take care of that wire also. That is why I like to see now the condition of the side branch. If necessary, I shall have to rewire the side branch, remove the side branch wire, then I shall do further procedure.
Otherwise, you can, sir, just anything where you can give it more distally, that will give you better support.
That is also correct. Epi. As because whenever we place the stent in the ostia, only then it is very difficult to.
So, Jamal bhai,
Yes,
is here. So, now that we are doing, I call it fine touch, but as Amal pointed out, that you'll be doing a
okay.
FFR for the CERT, right?
Yes.
And then we just heard from Dr. Colombo that will you be happy with this CERT physiology? Or will you?
Take it, sir.
I think you have IVUS on the table, and I go with IVUS.
Yes, sir.
Better and see what happened to the sir.
Yes. Let us see the IVAS. Give me the IVAS. See the present situation.
My point to the faculty is that it may be a different animal when you talk to bifurcating left main. Is that? Oh.
This is the final, up to this final view, and now I shall do IVAS to the LED. And
So interesting because at the same time, two operators are making two different comments. Imad is saying, it looks fine. Amal is saying there is definitely pinch. So how we resolve this?
We can take opinion from other, he is a great interventionist, Dr. Omar is there. So what about his opinion, Dr. Omar?
From this view, I think that's fine. That's fine. I mean, we can live as it is.
We can go home.
Yes.
Yes, I think so.
So we are going home. Anybody like to go further?
So, Fazila madam, I like to request her because he is one of the largest number of.
Highest, one of the highest. She has the highest number of left main PCI in Bangladesh. She has the highest number of rota in Bangladesh.
So, madam, your opinion, please.
Jamal, thank you so much for that.
It's my pleasure to tell you that because you are our asset.
But just one point, you just remove the jail wire. But
Yeah.
after removing the jail wire, I think maybe we should do a post-dilation port again, if you are not
Again.
planning to do a case or anything. Because when we remove the wire, we might need some space. So maybe another proximal optimization.
Okay, madam, we have done the pullback IVAS from the crystal LED to LM, and let us.
Ujjwala madam, we know that you have a long series of late pain, especially in our population. Can you share some experience regarding a particular sex variation and age variation of the late pain disease of our country? Sex variation or an age variation of the late pain disease
Malposition.
in our population. Can you share some experience with the audience and also?
Actually, I mean, in our center, you're aware of that. Now, the average maximum size of stent that we use is 3.5. And the next most common size of stent that we use for left is 4. And obviously, we use a stent which is the distal reference vessel, which is the I suppose that.
I was set the service cover. Everywhere. Dear sir, set class. On the where? Okay. I have recrossed the LCX. And what about the stent expansion?
So please go through the IVAS run.
Pullback, show that the pullback. You are seeing the pullback. Distal is there is no dissection. Stent is well expanded, but proximally a bit malalignment.
There is malposition.
So malposition. So I shall have to post dilate proximally once again. Look at that balloon.
To go with the higher diameter balloon like 5.0 into 6 or 5 into 8 like this. Because with 4.5 you have already post dilated the left main. So do you want a bigger balloon?
Sir.
Sir?
Yeah, 4.5 is available.
5 or 6,
So
5.
5 is also available.
So 5 you can use.
We have given 4.5. We have given already 4.5.
So now 5, have you got 5 in yourself?
5 days.
What pressure did you go up to with 4.5? What pressure?
Pressure.
Not inflation
That was
pressure.
18.
Inflation pressure.
18 atmosphere. Okay, once again, I am going another 5 to 10. After placement of the ostial standing to introduce the balloon, a bit difficult, and we must have to be cautious because I am in the ostium and beyond the ostium 1-2 millimeter, so I should not damage the ostial structures.
So you have recrossed the L6.
Yes, I have recrossed L6.
To me, the $1 million question is that this patient is 27. Right?
Okay? Yes.
So, what is the underlying pathophysiological mechanism? Is it all atherosclerotic? What is that LDL? Patient is not diabetic, right?
And patient is not diabetic, not hypertensive, and his lipid profile is also normal. Lipid profile is also normal. Only he has positive family history.
Because
Ujjwala madam was telling about the fibrotic.
Fibrotic, yes. That may be.
I think you should not push that much with this balloon.
Yes.
You should try to rewire again more correctly. Maybe you are going through the struts outside of the hosting or flat technique.
That is the SAR, but I am going to the LED. I have recrossed the SAR, but LED wire is the yes wire. Because you have told, that is why I have
You're recrossing again.
Yes. This is one has to say it again.
So this is a lot of advantage of radial, but this is one of the issue that sometimes it faces. Good alignment with coaxiality is very less.
Jade wires should be the safest way to go through inside.
I have entered into the LED with a loop, and now I re-enter into the circle.
The balloon is inside the catheter.
No, epi, guide catheter. No, not about this.
Yes, now it is better.
But I do not want to better, I do not want to hanker up for better for placing the LED left main guide after placing the stent. I want to remain a bit away.
Yeah, that is a very important message, especially
Yes, yes,
for
ma'am.
newcomers who are starting left main PCI. Once you've deployed your stent and it is covering the ostia, be very, very careful with any hardware that you're taking there or your catheter, because it's very easy to cause longitudinal deformation to
Longitudinal
totally
deformation.
destroy your stent. So one has to be very, very careful, which Professor Jamal is.
That is the one. That is the only reason that jail wire should be removed, because when you push and pull the catheter jail wire in LCA, that may cause the osteal injury, start injury, and the longitudinal section of the stent.
Yes. Give me the balloon. I have recrossed once again, and now I am trying once again with balloon. In our country, usually left main, I want to know from my respected faculty, Professor Fazluddin Somali, whether these young patients suffering from left main diseases, what is your experience regarding the use?
Thank you for that question, but as you already have noticed, that this is a young, with us, mainly very young patients, we have seen female patients, osteal disease, very significant osteal disease, and these patients often have fibromuscular dysplasia.
Okay. Yeah, that one.
We had a case yesterday also, a 26-year-old female lady physician who had severe osteal disease, and the disease extended up into the LAT as well, pretty much like this.
So this is 5 into 8 millimeter.
Yes, yes, yes. Stand It's not clear. Yes, it's all right. Go up. Just proximal part including the ostium. Okay. Now we have inflated it up to 12 atmosphere. Go up.
You can go up to 18.
Go. Eighteen, 20, 22, 24. Okay, let us see what is the scenario. Hello, Paran.